You've been at this for so many years now. What are the chances that what you've just described might happen this time? Is the environment any different than it has been?
Well, I'm a congenital optimist, so I think something can happen. I think something will happen. But there have to be certain preconditions for something to happen. First, the president-elect has really got to make health reform a top priority, and it means sequencing is very important. In 1993, 1994, even though President Clinton cared deeply about health care reform, there were several things that came before that. There was NAFTA, there was balancing the budget, and there was the debate about gays in the military. And by the time he gave his speech on health care in September of 93 and then issued his proposal in November of 93, much of his political capital had been expended. So this has got to happen early on, I believe, to be successful. Then I think it improves also an aura of inevitability, which I think actually existed at the very beginning of 1993. If you remember the history of 1993, you had Republican senators, led by Senators Dole and Chafee, who were prepared with a majority of Republicans in the United States Senate to try to work something out with the president. It was a bare majority. As time went on, that majority moved away, and finally the Republican Party said, you know, it's best not to give this president a victory, and they wound up being strong opponents. So I think timing is critically essential.
And is it not only that it happened early on in an administration, but that it happened quickly, that the process beginning to end happened quickly?
Yes, and the process needs to move quickly. Now, it doesn't mean that comprehensive health care reform happens all at once. Sometimes we've experienced that efforts at health care reform tried to bite off more than could be chewed. But there has to be a significant initiative that the president has got to push hard early on, and Congress has got to develop the mechanisms for getting it considered quickly. Remember, there are lots of different committees in Congress that have a piece of the action, and they guard their jurisdiction with great tenacity. So there's got to be a process to move that along in a fairly swift but deliberative manner.
A final question, given your hopes and aspirations, does it discourage you that there are some politicians, lawmakers on Capitol Hill already seeming to tamp down expectations about what can be done because of the economy?
Well, I've read some of the quotes by a few members on Capitol Hill, and obviously it's disappointing to read that. But I think that's where presidential leadership comes in, and the leadership in both houses of Congress has got to be clear that this has got to be a top priority. So I still think that we've got a pretty good chance of doing something significant in 2009. Obviously, it'll depend on the elections. Obviously, it'll depend on, will the president-elect make this an early top priority? If that happens, I think the conditions are right. Business wants it. Governors across the country want it. I think the key stakeholders are now trying to find ways to work together rather than be recalcitrant. So I'm more optimistic than I've ever been about this being a possible time we'll get it done.
We'll check back with you in 2009.
All right.
Thank you, Ron Pollack of Families USA.
Thank you.
Appreciate it.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.